Hello, my name is Dr. Florian Netzer. I'm a specialized vascular surgeon specialized on varicose veins in more than 20 years. Before you are undergoing any examination or maybe treatment with us, I want to explain you some simple facts about anatomy and function of the veins in your legs. So this table is showing the vessels of the leg, in red arteries, in blue the veins. The veins are being found in the legs in two totally different groups, one deep venous group and one superficial venous group. The deep venous group is consisting of only a few but thick veins embedded in the muscle, and the superficial veins are many tiny veins underneath the skin. So the deep veins are joining and joining until only one forefinger thick pelvic vein is coming out of the pelvis, the only way for the venous blood back to the heart for both systems. The superficial veins are forming a tiny network underneath the skin, most of them being less than 1 millimeter thick. Only two superficial veins may be up to 3 millimeters, the so-called stem veins, the great saphenous vein running all the way up here, joining the deep venous system in the groin, and the small saphenous vein doing the same, running over the calf on the back of the thigh and joining the deep venous system somewhere there. Both stem veins are not visible for us because they are a little bit deeper underneath the skin. So all unsightly varicose veins or spiders and threads are normally caused either by the great or small saphenous veins, sometimes by both. So normally the blood should flow back to the heart, climbing up the veins all the way up. Providing this, the veins are bearing valves, both systems, the deep and the superficial veins, are bearing valves every few centimeters. I'm showing you a venous valve now. You can see an open valve here and a closed valve here. So you can imagine the blood can go through here, but if flowing back, the valve will close. So if, for instance, the great saphenous vein, which is bearing around 20 valves normally, for some genetic reason, and most of the cases have a genetic reason, either familiar or either individual genetic reason. If for genetic reasons the valves of the great saphenous vein don't work properly, so what will happen? The blood won't climb up and flow back to the heart while you are standing or sitting. So the blood is then flowing back, pooling here, distending the great saphenous vein, which is still not visible for us. The first thing that we will mention or see, or notice or see, is distended superficial side branches, which are only a symptom of the distended great saphenous vein. So what we can see on the surface is only the symptom and only the very top of the iceberg. So it doesn't make any sense to treat only the visible veins, because they will come back for sure then. We have to find out whether the great or the small, or maybe both saphenous veins, are the reason for your visible varicose veins, and then we can treat those veins by destroying them. Destroying those veins or removing those veins does not mean that the body is missing them, because they gave up their proper function ages ago. They are now not longer doing the proper job, bringing a tiny amount of blood upwards, but they are doing the opposite. They are bringing a bigger amount of blood, a bigger volume of blood downwards, which is causing that pooling, which is then causing standing blood in the lower leg. Standing blood is due to clotting, is very prone to clotting, and moreover, over the overload with venous blood of the lower leg, the deep venous system will distend by the time, and by distending, the valves won't close any longer. So in the end of the day, we can have a deep venous problem which we can't cure any longer.